see the arrival of the Minister, the Honorable Dr. Terrance Dialsingh.
Okay, so thank you all very much. And you are from the food and beverage sector. Most of you, some of you from food and beverage. So you want to open it, right? That's a great to do. Okay, thank you all very much. All the best. Congratulations to you all.
Cindy in the
You, finance, for having faith in this process. Thank you. She wants me to give it to her. That is not a problem. My pleasure. What color you want? Red. You know I won't complain about that. Sit around.
T&M.
Sit around.
Go, go.
vaccinated by next weekend or so. So by the end of September, the goal is to have fully vaccinated 600,000 persons in Trinidad and Tobago by the end of September. The site we are at is under the auspices of the Southwest Regional Health Authority, and it is a site that has gotten rave reviews for its customer service, its quick turnover time, and patients are quite happy to be here. This site has the capacity to do about 1,500 doses per day, which is about average for the site. So today I am visiting the Southland. After here I am going to visit the Proman drive-through site in Couva. Tomorrow the media has already been invited, if you don't know already, to the Wallerfield drive-through site tomorrow at 9:30 a.m. But I imagine your companions in North will be covering that. What we are trying to do is make vaccines easily available in terms of reach, convenience, and accessibility via 109 health centers, about 11 mass vaccination sites, and 2 drive-thrus for now. Members of the public who don't have access to the mass vaccination sites are simply asked to go to your health center. Members of the public should not be coming to the mass vaccination sites. These sites are being used to vaccinate major groups like food and beverage, construction, and so on. But there are 109 health centers for the public to register their interest and get vaccinated there. So that is one message I would like to get out this morning, that members of the public visit your local health center, which is within walking distance or a short drop or a short ride, 109 throughout Trinidad and Tobago. The second message this morning is for the retail sector. As you know, the retail sector is currently closed. We would like to open the retail sector. So, the mass vaccination sites, through the individual chambers of commerce like San Fernando, Pinal-Debe, Tunapuna, Sangre Grande, Arima, they have been asked to compile their list, their databases of not only the owners of retail, whether it's a jewelry store, a shoe store, any kind of retail, and submit your names to your Chamber of Commerce, and you will be funneled through the mass vaccination sites. So we want to open it now to retail, in addition to all the other sectors that we have targeted like construction, food and beverage, manufacturing. So the simple message is vaccines are available, they are now accessible, we have reach, and we have started, as you know, a new communications campaign, which I am hoping everybody would have seen, Voices for Vaccination on TV, especially TV6. This morning, full page ads would have started in all the major newspapers, Newsday, The Guardian, The Express, using influencers, whether they are religious influencers, Nikki Crosby, a social influencer, and you will see more of those voices coming out more and more. Because the messaging has to be not only from the Ministry of Health, but also for persons who can identify with a social influencer. So you'll be seeing much more of those in the coming weeks and so on. So that is what we are about this morning, and thank you all for coming out, and we are now available for your questions.
What's an idea like how all of these initiatives that you all are doing now, would it be safe to say that we are on target for achieving herd immunity?
That is an excellent question. So herd immunity is 70% roughly of your population. Our population is 1.4 million, including children. So herd immunity is a percentage of your total population. Right now, we don't have vaccines registered in Trinidad for the under 18. So that knocks off 400,000 people. So it means to achieve herd immunity, 70% of 1.4 million is 980,000 people, which is close to 100% of your adult population. So what we are doing, we are making vaccines available to every adult, and there will be more coming. So a lot of the onus now is shared not only on the part of the government, but on the public to be vaccinated. That is why we have all this new messaging using religious leaders. Last night we had the Dharmacharya of the SAPA, former Chief Medical Officer, Dr. Ramprasad Parasram. We have had the Archbishop, we have had the Maulana Soleimani. This week you will see Reverend Berkeley from the Anglican Church. You will see other people. And we are hoping that these messages will resonate with groups of people to trust the vaccine. So we are trying to use non-government spokespersons, persons who are trusted in society, to speak to the population, to get vaccinated, which hopefully will lead to herd immunity.
That being said, does that also go, these factors also go a long way to negating the issue of vaccine hesitancy?
Yes.
Because you still, well, you have those messages going on, you will appreciate, you still have other people giving messages to the contrary, including a regurgitated version of sunlight kills COVID.
Yeah, so you have that sunlight kills COVID garbage, which was facilitated by a political leader, very irresponsibly so. But what is happening now is that social media, you may have noticed the comments made by other world leaders about the role of social media, especially Facebook, where their algorithms promote vaccine conspiracy theories more than vaccine facts. And that is something that we have to combat, and that is why we are using a strategy that we are using to get leaders in society who are trusted, non-political, to talk to the persons individually and collectively.
Mr. Minister,
May I ask you, from you and your house, building up with all these various challenges, because sometimes it seems like you and your team seem to be a little bit jaded at times.
Well, look, we've been battling this a year and a half. It's not easy. It's not easy. Many of us, especially the CMO, Dr. Richards, who work all hours of the night. I work all hours of the night. I work Saturdays and Sundays. But it's a labor of love. We enjoy doing it. And we can get out of this if we just vaccinate.
Minister, as we approach 1,000 deaths, what aspects of the handling of the pandemic are you happy with? And looking back, is there anything that you would change and do differently?
We have examined that at the ministry literally on a daily basis. What we know at the time is what we did at the time. There is nothing that we have said we could have done better or done differently. The fact is, people all around the world have died from COVID. Trinidad, unfortunately, is involved. And again, my deepest condolences to those families. We are going to cross that 1,000 mark very, very soon. These are real people with real families. It's a tragedy. But in the early days, it is also a reflection of how unhealthy we are as a society with NCDs, with diabetes, hypertension, obesity, and so on. So some good can come out of this if those who are diabetic start to take better care of themselves so they don't become a statistic, not only for COVID, but for future pandemics. For H1N1, most of the people, as Dr. Arthur can tell you, most of the fatalities from H1N1 will be, again, people with comorbidities who don't take care of themselves. I don't know if you want to make any comment on that.
Our dear minister is very accurate in saying that we have been battling this pandemic of the chronic communicable diseases for quite some time now. And unfortunately, that's a pandemic that we seem to be losing quite significantly at weight, because even in this one, we're going to see many persons suffering into COVID, but they have a lot of comorbidities. And that's why we encourage persons, 3 tenets. Exercise is critical for everyone. It improves your outcome in many ways. So exercise, eating well, including lots of fruits and vegetables, water as well, and ensuring that you know your numbers. So for example, by the time you get to a certain age, I say 35 to 40, or if you have a lot of family members with comorbidities, start doing your yearly checks. Check your blood sugar, check your blood pressure, know your cholesterol levels. At least have once a year annual checkups with your doctors so that you will know what you're dealing with. If we can pick up these things early enough, there are things that we can do to either delay the onset of complications for as long as possible. There are some persons who don't even see some of the complications coming in, which would be things like the heart disease, kidney disease. These are the things that we know as a society are the leading causes of death.
Minister, we're speaking about that because we've been seeing a worrying number of cases that's related to H1.
No. H1 season starts in October.
Minister, are we seeing people getting their first shot but not coming for their second shot?
So there will be a small group of people, but the gross data so far more or less indicates a 1-to-1 ratio, that most people who have had their first shots, thankfully, are coming in for their second shots. But there are some people who went abroad. There are some people who, when they had the appointment for their second shot, fell ill, couldn't get time off, but those tend to be in the minority, thankfully.
And are we seeing people having a bit of vaccine hesitancy, saying that they will have more options coming in the future? So people are saying they are not coming for one particular vaccine because they're hoping to get another one.
Okay,
Are you seeing that?
Radhika, I want to thank you for raising that. The public is advised that right now and for the foreseeable future, you have one vaccine available to you, which is WHO approved, the Sinopharm vaccine. The other vaccine we expect is going to be the Pfizer vaccine. But as the Honorable Prime Minister said on Saturday, that is the only vaccine we'll be getting approved for children under 18, between 12 and 18. And that is going to be reserved solely for our secondary school population. So if there's any adult who thinks they will delay taking their vaccine, waiting for another one, my urge is not to do so. You may put yourself in danger. We have a policy of only WHO vaccines. Sinopharm is one. Any Pfizer doses coming in are strictly reserved for our secondary school population.
Minister, we've been struggling with the people given the number of deaths in the past couple of months. What has been done, given that the borders were opened yesterday for us? Has there been any increased capacity with the opening of borders with the Delta variant? Has there been additional measures as a result of borders opening and our capabilities to manage a new variant in the feasibility design?
Thank you. So what we have done, and thank you for that question, Cindy, right? Excellent. So to enter the country, the steps we have taken to mitigate risk, we can't eliminate risk 100%. We have to mitigate risk. Because, as the Honorable Prime Minister said, and all countries, you have to find a way to learn to live with this virus. Right? So, one, you must present a negative PCR within 72 hours of booking. You must be fully vaccinated for a non-national or national. A non-national who is not vaccinated goes into quarantine. So those are the mitigating steps we have taken. All those are reasonable steps to mitigate against the risk of the Delta variant or any other variant coming in here. But we have to learn to live with the virus. And the University of the West Indies is already engaged in that genomic sequencing issue. We will be taking samples from returning people to test for the Delta variant or any other variant.
In terms of hospital capacity or anything?
Well, the hospital capacity is what it is, right? There is no more elastic in that. And that is why the vaccination program, you see, it comes back now to vaccination and the 3 Ws. If we vaccinate, wash your hands, wear your mask, and watch your distance, we could mitigate a lot of these risks. So the onus has now been put squarely on the population. Because let me ask, does the population want another lockdown? Do you want another lockdown? The answer is no. And if you don't want that, 2 things the population can do. Get vaccinated and follow the public health guidelines. No congregation, no partying, no setting. Come out, work, do what you have to do, and get vaccinated.
Minister, do we have statistics on the number of migrants or Venezuelan nationals that have taken the vaccine?
No, I don't have that statistic, but it is open to them. At this stage in the process, anybody in Trinidad and Tobago is free to access the vaccine. migrant, national, resident, citizen. Once you're a human being in Trinidad and Tobago, it is now open to anybody.
And there's one final thing.
Sure.
When I was at the penal mass vaccination site yesterday, regular citizens were coming out, not by sector.
Yeah.
And now you're saying that mass sites for the various sectors. How has the turnout been at the health centers? I mean, they're very small.
Yeah.
You know, with the last rollout, maybe 50 to 100
Yeah.
centers. Give me an idea of the capacity
Sure.
on Friday and Monday.
Yeah. So we have designated centers according to their size, small, medium, and large. 109. A small health center, as Dr. Amor could tell you, we had a meeting about 3 weeks ago. A small health center can do about 50 a day, a medium about 75, and a large could do about 100. So across the health center sector, they can comfortably do 7,000 a day, which is 3 mass vac sites. Because your average mass vac site is 1,005. So that's the capacity. It's just for residents to use it, right? So any resident in any area, whether it's Belgarden, Belmont, Charlottesville, Cedras, Chaguanas, if you are not in one of the sectors, simply register your interest with a health center, and they have the capacity to do 7,000 doses per day, which is 3 mass vac sites put together in one.
And some people still think there's walk-ins. Can you just clarify?
Yeah, so again, no walk-ins, you simply register your interest, they will call you, you make an appointment.
Minister,
Let's take one at a time.
Can you give us an update regarding the Pfizer vaccine in terms of cost, where it's coming from, when is it expected to arrive?
So I have no details as yet. As the Prime Minister said on Saturday, they had to sign off on 3 documents. He has signed off on that. As soon as we have details, as we always do, we share it with the media and the population.
And in terms of the Sinopharm vaccines, how many of those have been purchased, if any, using the loan agreement with China?
I don't know if it was purchased using the loan. What I could tell you is that this $800, 800,000 was in fact purchased together with the last batch of 200,000. So in total, we have purchased 1 million doses of Sinopharm vaccines.
At what average cost?
We cannot give you the cost because we have signed a non-disclosure agreement, as we have said very often.
What's your take on how the compliance has been to the relaxed protocol since yesterday with the Sacramento?
From what I saw in the public domain and speaking to a couple of persons in the industry, compliance seems to be very high, very good, and I want to congratulate the public on that. If we continue with that high level of compliance, then we don't have to lock down again and get vaccinated.
Would you say you were somewhat surprised to see that kind of reaction, because that's what we saw yesterday was not the typical Trinidad?
Yeah, you know, the consumer has a way of surprising you. Yes, I thought there would have been a big rush, but there wasn't. I am thankful for that, because it means less congregation. But hopefully things will ramp up and more people will come out for their favorite street food. My favorite doubles man was out yesterday, but I saw a crowd and I didn't go. So I'll pass again this evening.
Minister's suggestion was made that people should be tested before they go for the vaccine, right?
No.
A rapid test. Is that feasible?
There is no scientific evidence, Dr. Arthur.
No, that is not advised. It's not advised.
Answer the pertinent questions. So, for example, are you well to eat? Do you have any symptoms or feel symptoms? And if you are well, then you're supposed to get the vaccine.
okay, final question for you,
Yes,
Minister.
Ivan.
So yesterday there was an incident in Pinal, the Forgen, where members of the public came in to register, because one of the criteria we were told that you can come and you will be given an appointment. There were lots of people at the Pinal area, the Forgen, that was turned away yesterday. You care to comment on that?
So I
incident?
just answered that question to Cindy, that the mass, so let me repeat what I told Cindy. The mass vaccination sites are for the groups. We have 109 health centers throughout Trinidad and Tobago for villagers, people in communities to go and register their interest to get vaccinated. The mass vaccination sites
reserved for this, like construction and so on.
Minister, yesterday members were told to come out and be vaccinated. They came out and they were refused. They were returned. They were turned away.
Let the CEO talk about that because he will tell you what the operations are. The Minister of Health doesn't operate each mass vaccine.
Okay, thank you for the question. Yes, there was a small incident yesterday. We had our figures are about just about 40 persons who came as working without appointment. As per the government policy that we exercise at the RHAs, only persons with appointments. Even in that regard, the security department together with the clinical staff, they would have spoken and council persons, we still would have vaccinated in that one-off issue as much as they presented as many as we can. And therefore others were simply told to avail and return at a later time. So therefore it was just a small situation in our view, and therefore that was managed. The vast majority of persons there came with their legitimate appointment as per the government policy.
Doctor, there were a lot of people who said they cannot get access to the website. They cannot get, so that's why they came, and they were refused, even being taken their names for appointment.
Right, so the issue with the website in terms of the demand for the website is that how the system works is that once it is that the health center is filled, you would not be able to click on the website. So therefore persons would have wanted to book in particular areas, and therefore once it is booked, therefore you are not able. So we are very happy for the demand. What we want to tell the public is there are vaccines for everyone, and therefore whether if even you're not, it could take it as a resident going to the nearest health center as advised, but if you also work in one of the sectors, also through your sector or business, you can register under your company or employer and then get the vaccine at the mass vaccination site. So it is easy access by multiple methods. So anybody who has a complaint, they could certainly call 87 SWARA, but in terms of where we stand and where we see the vaccine uptake, it is very good, very high. Everyone will get vaccines, obviously, because the public health regulations are still in effect. As per the government policy, everybody can't congregate. So just to be patient, whether individual or whether through business, you will get the vaccine. There's vaccines for everybody.
How could people who don't have that criteria you talked about be vaccinated at these mass centers?
Don't have which criteria?
They have an appointment.
No, but we also have a system where you can't go to the health center to make inquiries if you are not able to easily register, and even then we will make an appointment for you, right? So that is the procedure. The information that we have is that the system, no system is perfect, but persons are very satisfied with the system. For example, yesterday alone, if my figures are correctly, probably vaccinated across all modalities, about 4,000 persons in one day. And that is still, there's still room to accept and get more. So the key message is by appointment. We don't want crowds. Everybody could get vaccines following the government policy, which is working. Individuals to your nearest health center. If you work at a company or one of the priority sectors, you can register to your sector and you will be accommodated.
Dr. How many people was vaccinated at the Forgen yesterday?
I don't have the exact number. I believe it might have been about 600. No, it was more than that, 600 and something. I believe. I don't have the exact number on me. So, like later down in the week, we have sectors. So it is a collaborative effort. It's not a one entity show. We have Southwest Regional Health Authority taking guidance from the Ministry of Health, working with other sectors, just in order to focus on the population to get vaccinated.
Thank you.
Any other questions, ladies and gentlemen?
Did you all have a drive-in today? A drive-by today? Did you all have a drive-through today at the SAPA? You care to tell us a little bit about this, Dr. Amo?
Yes, so therefore, based on our analysis, generally on mornings with the bookings, we notice both walk-ins as well as you see a lot of vehicular traffic. So it is just an internal pilot that we did Monday and Tuesday to just have a small drive-through between 7:30 a.m. and 9:30 a.m. And we certainly are testing it. So basically how we work in the healthcare industry in terms of we have a small pilot, see if it works. So far the results are encouraging. So what it does, it gives people convenience to come in the early morning to get their dose in the vehicle, and therefore it also prevents the congregating, because we still have to follow the laws of the country with respect to limiting congregation. So it's just small scale at this point, but it runs in complementarity with the walkthrough at this point.
And how many passengers one vehicle? Is there a max or there's a minimum? Can you tell us? Or if it's just one per person in a car?
Whether it is at SAPA or anywhere in the country, everybody is required to follow the laws. So the government has already prescribed the maximum amount of occupants per car. So therefore, as far as there's one per window, so once you follow those guidelines, well, then you would be eligible to be offered to do the drive-thru just in the early hours of the morning, as I described. So the number of occupants per car is based on us complying with the law. As you notice, police services here, so the police service also do their part and they patrol the sites at regular frequencies to make sure that the law is being followed.
You think this could be ramped up in the future?
It is too early to say. So certainly with the results of the pilot, we will then refer to the Ministry of Health, and then certainly from there we will move forward with respect to decision-making process under the guidance of the Ministry.
So let me give you some figures about the drive-through mass vac site. So yesterday, as I indicated at the press conference, Proman started their first pilot of the drive-through site in Atogolden, where we are now. They were able to do 500 in 4 hours as a pilot. They are piloting again today, and then they start tomorrow in full. The expectation is they could do about 1,000 to 1,500 in the Atogolden. And then similarly at the Waterfield, which cranks up from tomorrow, we are looking to do similar figures in that drive-through. So 2 drive-throughs will be fully up and running by tomorrow, but they are being piloted.
Okay. One final question. Can you give us a quick update on the AstraZeneca vaccine in terms of how many are remaining?
Oh, I don't have a figure, but what we have done, the 2-dose vaccines, we always give out half and reserve half. So everybody who got their first shot is guaranteed a second shot. But we do have a backup shipment coming of 33,800 in August. So we have enough AstraZeneca for second dosing for everybody who received their first dose. Okay guys? Thank you all very much. Continue to work with us, and thank you all very much. God bless you.
So there's no possibility for us to see a drive